Hi everyone. Hey, Doug Grant here. I wanted to do a little special Loom video for you about this email that goes out every month that highlights the most important blogs that I wrote during the previous month, the ones that really should have the most impact in your life and can benefit you. And so I want to go through just each one really quick in this video. That way it'll maybe spur some interest for you to look a little bit more in depth into the ones that really can help impact your life and help you reach optimal health the fastest. So let's go into them real quick. And the first one is really cool because it's talking about the antidepressant epidemic and vitamin B6. And so I'm going to click into that study or in that blog real quick with you and go over it. Now, most of the time when we're talking about depression, we're talking about vitamin D deficiency because vitamin D deficiency every time, especially if it gets real low, is indicative of depression, of being able to, basically have lower moods, self-esteem, even clinical depression. And the neat thing about it also is that low vitamin D also shows us that we're more susceptible to virus. So vitamin D is a big deal. But this blog, and there's probably 20 different blogs. If you go on our blog and type in vitamin D, you'll find vitamin D on depression. But this was a really interesting study that went on vitamin B and talking about the problem with the post-pandemic depression and how it's tripled over the course of the first year of the pandemic and on through. And with this one, it talks about the study in 2019 that B vitamins really helped maintain concentration skills amongst people. It was large meta-analysis, meaning a study of a whole bunch of studies that was done, showed that vitamin B was able to reduce cognitive decline. And so vitamin B is huge, okay, but help with all these other things. But in this specific blog, besides referring to those, it goes through and talks about B6 and B12 supplements and how they helped dramatically with depression, be able to keep a positive mindset and focus. So you want to look at that if that interests you. So just another way to look at depression, make sure your vitamin D and B levels are up. The next study was done with athletes and to show that they actually perform better when they have a healthy gut microbiome. And I'm going to click into it, just like you can do with this email and all the studies. And what that means by a healthy gut microbiome is a probiotics, a friendly flora. For example, fermented foods like kimchi, things like that. Those are foods that have probiotics or a friendly flora in them that help with the microbiota in the gut. What they found was with these athletes that they were able to perform at a higher level when their friendly bacteria levels were where they should be, and what we call the fungal microbiota of the individual. And it was really interesting too because they were able to not only improve performance, but also their digestive system, their immunity was higher. And we also know that they saw which diets helped with the friendly bacteria in your body because they're supposed to be able to colonize and grow and help be that second immune system and do all those great things for you. Many times we ruin them. And the higher the protein diet, actually, the more harm that was done to the gut and to the friendly bacteria. So if you're on a high protein diet, you definitely want to add back in the probiotics and make sure that if you're on the high carbohydrate diet, they're healthy carbohydrates, lower glycemic, basically real simply, more fresh berries, vegetables, healthy like grains, especially. But we're talking the ancient type grains, okay? And so the other one that was talked about in this blog recap was how folic acid supplements lower cardiovascular risks. And this is interesting because folic acid usually is references to the synthetic form of the B vitamin. And we like the whole food form, obviously. And so it actually goes through and talks about that and the importance of needing to be this B9 needs to be more of a folate, that it needs to be a whole food based. And when it is, it actually works better in the body. So the body doesn't have to methylate it. And the benefits of that, which is really, really huge. In this study, they were able to show that with the group that actually had this B9 folic acid from folate, that it was able to significantly improve this homocysteine and sortilin levels in the body, basically helped out with diabetes dramatically. So it's a really, really cool study to check out. And that's another one that's in the blog. So check out those blogs and be able to, you can also go into the blog on optimalhealthsystems.com/blog, or just click on it and type in any word you want, any condition you're looking for, any vitamin, and see if there's a blog that I wrote on it over the last so many years, and see if that will help you. It'll also lead you to either the nutrition or the supplements to be able to help with that condition that the study talks about. So I hope this helps. Let us know if this little Loom video is something that's beneficial to you, that should go out monthly as we do the review of the blogs that went out for the previous month. Have a good one. Keep chewing.